Good morning. Thank you for joining us here for the main stop on the Protect Our Care, Your Health, Your Vote virtual tour. We really appreciate you joining us here today. And we've got a slate of speakers who are eager to share with you their thoughts on where we are in this process as we lead up to this really historic election. My name is Vivian Mchale. I'm the Maine State Director for Protect Our Care. And as you know, last month, as you may know, I hope you know, last month, House Speaker Nancy Pelosi and Senate Democratic leader Chuck Schumer kicked off this tour to make sure that voters know just how serious it is that healthcare is on the ballot this November like no other election. This tour will make a total of 16 stops in 16 key states for the 2020 election, and we're glad that you joined us today for Main Stop. Unfortunately and frighteningly, Trump and his Republican colleagues have taken every opportunity to sabotage our healthcare, pledging to rip healthcare away from millions of Americans, including about 83,000 Mainers, and gut protections for patients with pre-existing conditions, which include over 500,000 Mainers. Also roiling right now is the continued argument before the Supreme Court where the Trump administration is attempting to dismantle the ACA, the Affordable Care Act, in its entirety. And that would mean dismantling care and healthcare security for over 135 million Americans. Joe Biden and the Democrats in Congress, however, are fighting to lower costs and better healthcare, and they want to build on the Affordable Care Act instead of burn it all down, the starkest contrast ever with our current administration. Marking these unsettled, scary times, just exponentially so, is of course the pandemic that we are all enduring and navigating. This is Protect Our Care's third tour, and we're bringing together important local voices from each state to highlight this impact of Trump's failed coronavirus leadership, the fight before the Supreme Court, his overall ongoing war on pre-existing conditions, Medicaid, Medicare, and his failure to lower the cost of prescription drugs. With me today are Senate President Troy Jackson, Marie Folitar, Representative Thom Harnett, and Speaker of the House Sara Gideon. I'm going to start today by introducing Senator Jackson. We're really glad to have you here today. We'll turn to you. Thank you.
Well, thank you, and actually still good morning. Thank you, Vivian, and thank everyone in Protect Our Care for putting this event together. My name is Troy Jackson. I'm a fifth generation logger from Northern Maine. And in the legislature, I have the real honor of serving as Maine Senate President. You know, I got into politics what seems like a long time ago, and my number one driving issue then was healthcare. You know, living on the Canadian border, I see, a country that goes daily without having to worry about where they're going to get their healthcare from, where they're going to get their prescription drugs from. I literally, in places like Fort Kent, Madawaska, Van Buren, you literally can look across the St. John River and see people over there that don't have the same concerns that we're facing over here in Maine and the United States. And so the reason for me is real simple. It's because healthcare is about freedom. It's about knowing that, working class people, everyone, when they lay down at night, they don't have the constant worry about what's going to happen if they or somebody in their family finds themselves sick. Being able to go to your doctor, potentially having your life put at risk. People shouldn't have to deal with that in this country, a country that's, one of the richest in the nation, in the world. And for me, living with health insurance for long periods of my life, working with people in an industry, the logging industry, that typically doesn't have health insurance, doesn't have employer benefit health insurance, and having a pre-existing condition like my own, I understand what the ACA now means for families. In Maine, an estimated 225,000 people have a pre-existing condition that would have been declined before the ACA was enacted, or could have been, and quite often were. And the reality is that, people with pre-existing conditions, we just can't afford to go back to the way things were before the ACA. Like I said, no one should be denied health care in this country. I mean, I believe wholeheartedly, every bone in my body, that health care is a right. It's not something that the privileged should get, and you have to try and claw and dig your way up to that elite status. There's millions of people across this country who would be out of luck without the ACA, and I think that we need to do more than simply protect the Affordable Care Act. For too many people, healthcare still is just out of reach, and it's where access to healthcare coverage, high cost of prescription drugs, and the never-ending patient fees, co-pays, surprise bills. These things are all unacceptable, and I think that it's without a doubt that these issues are very much where Congress should be deciding them. I mean, we should have a national plan across every state so that everyone knows that they're going to have those protections. But we know that the way things are currently, it's not happening, and we need Congress, to do these things, across each state. But because we knew that it was such a black hole, we weren't willing to wait around here in Maine. So over the past 2 years, we've taken matters in our own hands. We've encouraged other states to push forward also, so that many states maybe could push Congress to do the right thing, if at anything, try and embarrass them to do the right thing. But understand that, working for the big insurance lobby and the big pharmaceutical lobby is not what people elect, congressmen and senators, congresspeople and senators to go to Washington for. Last year we took on Big Pharma with 4 plans, 4 bills, and we won. They fought us every step of the way, but we won. And Governor Mills signed those 4 bills into law that could bring real relief to Maine people, in the future. And this year we passed or put forward 4 bills on the healthcare system to try and prioritize patients over profits. I think at this point, some of our work, along with our partners, Protect Care and AARP, has shown that healthcare actually rates in Maine could drop as much as 13%. But that's still not enough, and that doesn't mean that they won't go up in the future for a lot of different reasons. But the reason why we're taking aggressive action is that, it's simple. We just can't afford to wait any longer. I mean, it'll be coming up on 18 years that I've served in the legislature, and it's a constant thing that I hear from my constituents. I feel it myself. I feel it from my family, my community, and it's really one of the biggest reasons that people have elected me. They know that I'm all in on this issue, and even though I haven't been able to deliver as to the extent that I wanted, people know that there's someone that's fighting for them here in the Maine Senate and the Maine House. And it's clear. I mean, I never forget these things because I hear about it every day. Heartbreaking stories that people talk to me about. I just get off the phone with a senior that is in this donut hole problem with his prescription drugs. The price that they want, he has health insurance, but it doesn't cover his insulin. It's like $400 and some a month. It's ridiculous. The price that prescriptions cost now. This week there was a congresswoman that brought one of the healthcare executives to task because they raised the price because they could. And what that did for his bottom line, not the companies, but his bottom line was insane. The money that's being spent in this industry to basically, just give profits to people and not care at all to the working class, the everyday people, our seniors, is ridiculous and sad and embarrassing. And that's really one of the things that I'd probably like to finish with, just think about it. Think about who decides these things for all of us. Myself included. Every one of them in DC and state houses across the nation are elected officials that have government-sponsored health care. Every one of them. And they're making the decision for who else in this country is worthy enough to have that government-sponsored health care also. And that's an unbelievable embarrassment to someone like myself, that they're not deciding that everyone should. Why elected officials think that they should be better than anyone else is sickening to me. And it's embarrassing to me that, I have to face constituents and defend, people's votes on stuff like that. It's just incredible that anyone could be that callous and heartless. So, anytime, regardless of who it is, go out to take these votes, think about what the consequences is and who's actually got your best interest at heart, because this, regardless of what political party, it's just unbelievable that anyone can make this decision to throw other people off of healthcare. And that's what we're basically dealing with right now in the Supreme Court. That is a joke that this can even be allowed to happen at this moment in our time. So I hope people understand what really is at stake here in all of these elections is that, people that have what you don't have are making sure that you can't climb that ladder to elitism that they already enjoy. And so it really is very personal. It's something that basically, for lack of a better word, pisses me off. And I want to say, thanks for having me on today. Like I said, this is a big deal. I'm hoping that people will get out and support candidates that actually have their best interests at heart. Thank you for having me here today, and I really do appreciate the work that Protect Our Care does, because we need these types of groups, making sure people understand what's at stake.
Thank you so much, Senator Jackson, and we appreciate all the work you've done in being here today and such a strong voice for Protect Our Care. I'd like to introduce Marie Folitar, who is here today as a patient who manages rare diseases and also as the Executive Director of Mainers for Accountable Leadership. Welcome, Marie.
Thank you, Vivian, and thank you everyone here for showing up for healthcare today. When I was 13, I learned a hard lesson about parity in healthcare. My father was debilitated with depression, and he could no longer work. He sat in his study, our converted guest room, every day, needing treatment that he could not access, as his healthcare wouldn't cover mental health care. I was heartbroken, scared, frantic, and I wanted my dad back. I wanted my dad to receive the help he needed. So I began advocating. I wanted to ensure that he and others who suffered from depression and other mental illnesses could receive the treatment they needed. In 1994, at 17, I presented my vision of healthcare reform to then Representative Olympia Snowe and former Representative Tom Andrews. Healthcare reform was imminent with the Clinton administration, or so I believed. But it wasn't until 2009 when President Obama passed the Affordable Care Act.
Marie, I think we might have lost your audio.
Can you hear me now?
Yes, thank you so much.
Oh, sure. It wasn't until 2009 when President Obama passed the Affordable Care Act that parity in healthcare was mandated, and everyone with a mental healthcare diagnosis could receive the same access to healthcare as people with physical illnesses. I don't remember a time when I wasn't worried about access to healthcare, or the struggle of myself living with a pre-existing condition or someone I loved. Once I was diagnosed with my 10th pre-existing condition, and upon President Trump's election, I have had few nights of deep rest, knowing and wondering when the day was that I would wake up without protection. I'm a rare. It means I manage rare diseases that are not easily diagnosed or treated. We fill emergency rooms and we cost a significant amount of money to keep alive. I cost about $2,000 a month in prescription drugs right now. And before the Affordable Care Act, living with a pre-existing condition was a constant difficulty for getting healthcare. And through people's generosity, I managed to receive treatment. But just as car insurers raise prices on drivers with car accidents, healthcare insurers set individuals with more extensive medical histories like mine with higher premiums, and in some places put us in high-risk pools. 15 years after first being touched with healthcare inequities, the ACA was passed. And a weight was lifted. No longer would I have to overpay for healthcare. No longer would I be threatened with my premiums being hiked. No longer would I worry about life without care. But Trump and his Republican colleagues began fighting tooth and nail to dismantle the ACA the moment they entered. And Susan Collins has voted against the ACA or funding for the ACA over 10 times. And that means voting against ensuring healthcare for people like me. So when this administration began taking healthcare under attack, I threw myself into the fight to protect us and advocated about 30 to 40 hours a week. And they started with the repeal bill. And for several months in 2017, we had 3 attacks on our healthcare. And with a public surge enough of opposition, we were able to stop that. But relief was short-lived because the next famous piece of legislation that Trump and his administration tried to ram through was the infamous tax bill. And among many provisions of that tax cut that gave tax cuts to corporations and wealthy families was the elimination of the individual mandate. And the moment the mandate was removed, hungry governors and attorney generals were able to file suit. So over the past few years, this lawsuit has worked its way up to the Supreme Court, which will hear the arguments on the case on November 10th, 1 week after the election, carefully timed. And if that lawsuit is successful, Trump will have finally torn down the ACA, and with it, the protections for pre-existing conditions that give peace of mind for people like me all around the country. But this would be cruel any day, but in the middle of a pandemic that's raging across our country that specifically targets people living with previous medical conditions, it's criminal. Trump and his administration are actively trying to take away healthcare from the most vulnerable people during a pandemic when everyone is at risk for a pre-existing condition. But again, I can comfort myself because the Maine legislature did intervene to make sure that pre-existing conditions would be protected, even if the ACA is repealed. But there are still Americans who could be denied healthcare just because they've had COVID-19, just because they were born with a genetic defect, just because they struggle with their health. And here in Maine, the Trump lawsuit would strip healthcare coverage from nearly 100,000 Mainers. It could end our popular Maine Care program and force kids off their family's healthcare plan 6 years earlier. Healthcare and dental care are a human right, full stop. Everyone has a right to live, and that is the bottom line. You know, when you check into a hotel room and there's that restaurant and location guide? At this stage, we need a welcome to this state. You can have healthcare. You will be protected if you have a pre-existing condition. you also need to know the COVID-19 threat level. And it shouldn't be that way. You shouldn't have to worry about crossing the border into another state to receive the help that you need. And it's clear that our nation's healthcare system is in crisis. And it's clear that if Donald Trump gets away with it, the healthcare of millions of Americans, just like me, will be on the chopping block. Thank you for fighting. And let's protect the ACA and then ensure that we have healthcare for every American in this country.
Thank you, Marie. We appreciate you being here. I'd like to introduce State Representative Thom Harnett. Thom, thanks for joining us. I'll turn it over to you.
Thank you very much, Vivian, and thank you for having me here today to discuss this important topic. If I was not on this call, I would be calling my friends and neighbors, because it's the time of year I'm calling constituents, because I can't go knock on doors because of the pandemic. And I've got to tell you, when I call my friends and neighbors, the number one issue on most people's mind is healthcare. They ask me, what if I get sick? What if my spouse gets sick? What if my partner gets sick? What if my kids get sick? And what if we lose our health insurance in the midst of this crisis? All of this has been made worse by the COVID-19 pandemic. COVID-19 has laid bare and brutally exposed all of the failures of our current healthcare system. The simple facts are the poor suffer more, they always have. People of color suffer more, they always have. Indigenous people suffer more, they always have. And uninsured people suffer more, as they always have. And now everyone is scared. Everyone I talk to is afraid. Even those with insurance, particularly if they have it under the ACA, are terrified. We can change that, and that's what we're trying to do here today. To bring about that change and to reduce that fear and anxiety, we must join and continue to work with Protect Our Care, State Senate President Troy Jackson, Speaker Sara Gideon, and advocates like Marie Folitar and Kristen Urquiza, who could not be here today. We have to fight against the relentless assaults led by President Trump and his Republican enablers against the Affordable Care Act, expanded Medicaid, and other programs that are designed to make certain that healthcare is finally recognized in Maine and the United States as a human right and not a privilege bestowed upon the few. As President Jackson pointed out, do not forget for a moment that the members of Congress that are behind the challenges to these programs all have the best medical insurance, our tax dollars.
Are you able to watch on like the regular non-participant?
We can pay for their insurance. We pay for their insurance while they try to strip it away from millions of our fellow Americans.
That I sent around.
Our friends and neighbors. Try to wrap your head around that. I cannot, and I am thankful for the people on this call and for the people at Protect Our Care who are fighting to hold on to the ACA. COVID-19 and our public response to it have made the geographic, racial, and socioeconomic discrepancies regarding access to healthcare and positive outcomes as clear as day. Just yesterday, the Center for American Progress reported that nearly 30% of workers of color have a condition putting them at greater risk of getting infected with COVID-19. And these same communities are less able to withstand the economic losses caused by losing their jobs and possibly losing their health care. Black, Latinx, and Native people are 2.5 times more likely to be infected with COVID and 4.5 more times likely to be hospitalized than their white counterparts. And the death rate is double for those communities as compared to white Americans. It is absolutely immoral and outrageous to place our poor, elderly, and other vulnerable populations, which are often determined by the color of one's skin, at risk of losing their lives and the lives of their loved ones due to a morally bankrupt political ideology. Add that to the millions of people, as Marie pointed out, that are losing their health insurance because they're losing their jobs during this pandemic. And we need the ACA now more than ever in terms of dealing with pre-existing conditions. Over 6 million people have been infected with COVID-19. That means over 6 million people now have a pre-existing condition that could make them unable to secure insurance, and we know that number is going up. So where would these people go? Where would our friends and families go if the Affordable Care Act is dismantled by the Republicans and the Supreme Court? Where will the friends and the neighbors that I've been talking to on the phone every day turn? When they ask me the questions, I can't answer them. I can't respond to their pleas for help. I cannot live with that. I won't live with that. And we have no choice but to fight to continue to protect our care. Thank you very much, Vivian, and back to you.
Thom, thank you so very much for your words and sharing your experience of everyday matters that you are working so hard to represent. And thank you for fighting to protect our care. Before I welcome Speaker Sara Gideon, who we're very glad to have here with us today, I did want to follow up on what Thom mentioned. We were hoping to have Kristen Urquiza join us today. Kristen is a resident of Arizona, and she's co-founder of an organization called Marked by COVID. Unfortunately, she is not able to join us today. Kristen was a guest of the Vice President of Joe Biden at the presidential debate earlier this week because she lost her father to COVID and has been very outspoken and impactful about the failure of this administration to guide us and keep us safe during this pandemic. Her father passed away, and with her obituary, she became an advocate and therefore became Joe Biden's guest, unfortunately exposing herself to the president. And given the announcement of his testing positive, she was not able to be with us here today, as she is, of course, taking care of herself. And we wish her the absolute best. I do want to take 90 seconds to read the statement that she put out today before welcoming Speaker Gideon, because her words are incredibly, incredibly important. As Kristen wrote earlier this morning, I was invited by Vice President Biden to the debate to represent my dad, who died of COVID after Arizona Governor Doug Ducey, Trump's willing partner in crime, lifted the state's shelter-in-place order even as COVID rates were skyrocketing, and announced on television that it was safe to return to normal life if you were free of pre-existing conditions. So in a way, I was not surprised to learn that I've now been exposed to COVID by the Donald himself, as I sat about 15 feet away from him in the very first row of the debate hall while he yelled and mocked VP Biden for wearing masks. Every attendee, myself included, was only allowed into the debate hall after we tested COVID negative. But given the limitations of rapid testing and Cleveland's own COVID rules, everyone in that hall should have been wearing masks. And even though every one of Biden's guests managed to do this, Trump's guests were shockingly barefaced. Vice President Biden and his guests took every precaution to ensure the safety of all those inside the debate hall. And yet again, Donald Trump's contemptuous disregard for science and the value of human lives has jeopardized the lives of Americans, including myself. The Trump family exposed every attendee at the debate: guests, workers, members of Congress, Secret Service agents, members of the media, and janitors to a deadly virus that has killed over 200,000 Americans to date, with another 1,000 dying each day, that Donald Trump refuses to take leadership and protect Americans from this deadly virus. Irresponsible is an understatement. This is criminal. How many people must die before we deliver what the American people deserve: a coordinated, data-driven national response to this pandemic? How many more COVID survivors, COVID families, and all others marked by COVID must suffer before our losses are acknowledged and recognized? Kristen writes, I am terrified. I know the darkest result of COVID: an undignified and lonesome death. Something I would not wish upon my worst enemy, present company included. I am working to get a test as soon as possible and will quarantine until I'm certain that I'm not putting others at risk. So Kristen, we thank you for your work, and we miss being with you here today and wish you and your family well. And with that, I am thrilled to welcome Speaker of the Maine House of Representatives, Sara Gideon. Thank you so much for being with us, Speaker Gideon.
Thank you, Vivian. Thank you for inviting me to be a part of this today. I want to first just recognize Kristen and say I am so sorry for your loss and also for what you're going through. But I thank you for sharing the words that you did today about what is happening and why your life is now in danger. I also just want to take a moment to thank Marie for so clearly articulating what is happening for you and for millions of Americans who live with pre-existing conditions, and for so clearly being able to convey the fear and worry that you live with every day and the position that you are put into by people who are making decisions about healthcare and who are trying to take your healthcare away. I am so sorry for that. President Jackson and Representative Harnett, it is an honor to be here with you and fight alongside you every day in this mission. So I want to thank so much Protect Our Care for bringing this conversation forward today, for giving us this space to make sure that we are talking about healthcare. I can't think of a more important subject for us to be focusing on, because every single Mainer and every single American deserves access to affordable quality healthcare. Yet even in the midst of a pandemic, as I know others have said before me today, we see people losing their healthcare along with their paycheck. And we see this president and national Republicans push forward to remove healthcare from millions more. So let us be loud and clear in our voice today. It's time to build and it's time to strengthen our healthcare system. It's time to make it more affordable and more accessible. Now, throughout our time in the legislature, increasing that access and affordability has been a priority. It's why we fought for Medicaid expansion for years. It's why our first bill in 2019, LD1, required insurance companies to include basic patient protections and healthcare plans offered in Maine, ensuring that Mainers with pre-existing conditions would not be denied coverage. And of course, as we know and have talked about today, we were forced to do that because of that tax bill vote that has put the Affordable Care Act into the extreme jeopardy that it is in today. It's why in the past legislative session back in January, which seems so very long ago now, I was so proud to stand with Senate President Jackson and Representative Harnett and our House and Senate Democrats to put forward a Patients First package. 2 of my bills that were in that package are now law. All 4 of those bills were critical to helping Mainers face extreme hardship. And that was true before COVID-19, but even more true as COVID-19 has landed upon us. We were also able to act quickly when it came to COVID-19 relief legislation before we suspended our session. And we did that through rapid, decisive, bipartisan responses, passing laws to help Mainers take care of themselves and their families and ensure that they could avoid spreading illness without fear of losing a paycheck. We invested in public health nursing and the Maine CDC and put money into a fund to respond to COVID-19 while shifting major resources to make sure that both telehealth could be expanded and that physician assistants would be able to help do the work that was needed from the medical community. Throughout all of this crisis, really the point is this, that our priority was making sure Mainers were going to be taken care of. Now, we did this knowing that what was truly needed was comprehensive and cohesive federal action, leadership to protect the health of every American. That includes the safety of our healthcare workforce, but all of our essential workers and all of our people. And unbelievably, in the early days of COVID-19, as we learned, Donald Trump knew but hid the truth from the American people, refusing to listen to or act on the advice of public health experts. And the loss of Americans like Kristen's dad and more than 200,000 others, well, we have to remember every single one of those was somebody's wife or husband or father or mother or daughter or son. The response from the Trump administration and now the continued bickering from the Senate that has given no additional help for us as states or municipalities or people has left us hamstrung as we still work to increase the number of tests to respond to COVID-19, to make sure that we are producing and distributing the amount of personal protective equipment that we need in this country, even as we face a possible resurge and definite rising numbers of COVID-19. Now, instead of passing aid that I just talked about, which we all need, we unbelievably see a United States Senate that has continued to confirm Donald Trump's judicial nominees even during this time period while they have done nothing else. We've seen lower court nominees who oppose reproductive health care choice be confirmed as recently as just the last couple of weeks. And of course, we see a Supreme Court nominee who calls the previous Supreme Court's upholding of the Affordable Care Act, quote, illegitimate. Make no mistake, instead of increasing access to healthcare for people, they are literally trying to take it away. The Supreme Court, as Marie said, will begin hearing those oral arguments in the very case that can remove patient protections and healthcare insurance from millions of Americans, and it starts 1 week after Election Day. So let's be very clear about what is at stake here. It is our health and it's our healthcare. And whether you are a 7-year-old asthmatic or a 58-year-old multiple myeloma survivor, you deserve to see a doctor when you need one and to get the medicine your diagnosis demands to stay healthy and to stay alive. I want to be very clear about this. What we are voting on in this election is healthcare. So all of us need to vote like our life depends on it, because it does. I want to thank you all so much for inviting me to be a part of this. I want to thank you all for the work that you do in this arena. And I want to say that I believe that we will find the way to make sure that every person in this country has access to that most basic human right, healthcare, because we are all in this together. Thank you so much. And Vivian, I hand it back to you.
Thank you so much, Madam Speaker. We are grateful for your words and for championing this fight along with everyone else on the call today. We'd like to take a few minutes to open this up for any questions, and we'd like to remind folks that you can ask questions if you're on Zoom, in the Q&A chat box, or if you're watching by Facebook Live, through the comments. It doesn't look like we have any questions at this time, but thank you so much for sharing your experiences in your work for and with Mainers every day, for raising up your voices to continue this fight. And as Speaker Gideon said, our lives are on the line. Our lives, our health is at stake. Your health, your vote, your health is on the ballot, and please vote like our lives depend on it. Thank you so much from Protect Our Care. Please be well.